Yes, Dr.
Hello.
Sheila. Yes.
Good evening, sir. Good evening, everyone. Today, IFPH is conducting its 2147th day of daily webinar series. Before starting, 1 minute silent prayer. Thank you all. I am welcoming you all to this wonderful platform. So, I am today's moderator, Dr. Sheila Prem. Our guest is Dr. Sweta Shah, MD Homeo, Associate Professor for Department of Practice of Medicine, Anand College of Homeopathy, Vijaypur, Maharashtra, Homeopathy Consultant, V-Care Scientific Homeopathy Clinic, Kolhapur and Jaisinghpur, Maharashtra. And today's topic is menopause diet and homeopathy. So we are warmly welcome dear Shweta Shah to this wonderful platform. So now you can start. Please, ma'am. She already joined, sir?
Yes, sorry to say that Dr. Seda Shah is unable to attend the session
Okay.
due to heavy rain and internet problem in that part of India. So we can go ahead with the discussion. I think that is the better thing. We have talked different subject on this forum, so see what are the probabilities about the same thing. In same this subject can be discussed. Hope all of you will join one by one uh, in this discussion. That's the only thing that we can do at this juncture. Because just 10 minutes ago, she called me and told me that it's heavy rain. She couldn't even connect the net with the Zoom. So sorry to say such a thing, but this thing can happen due to natural calamities. Okay. Anyway, the topic is
Menopause diet and homeopathy, sir.
yes, that's a very good subject. As you all know, menopause is a very, very important period as far as women's life is concerned. And but how to know that the person is under menopausal stage? But most people didn't realize what is happening in her, or whether the patient or the people around her. But what we can do is that usually people may come to us with the doctor, I have some mental problem nowadays. I don't know why this. I have regular periods earlier, but nowadays it is not like that. It is in a different way. It happens sometimes it misses 1 or 2 months or some 3 months. Then again it comes with severe flow, and sometimes it may happen twice in a month, and that too also it is very troublesome for 5 to 7 days, full of flashes and blood stains, and I am very much tired, and I don't know why these things happens. Is there any fibroid inside my body? Is it due to some cancer, or she may have so much depressions. In the early part of sessions, people used to say that the menopausal area age is usually between 45 to 55, but things are entirely different now. What we see is that people having this problem even from 35 years old, from that is because of the lifestyle changes. Things happens all of a sudden, and because sometimes you may find that the husband may come and say, I don't know, doctor, she is shouting nowadays every day. Whenever I used to say something, she used to start shouting at me, and not only towards me but also to the people around her, and particularly the children, and they are in a so that kind of thing is also there. Sometimes some other husband may come and tell like this, doctor, she was very active and she was very energetic, but nowadays she is not talking in a better way. She is always sitting there is not talking to anyone. Also, that kind of depression is also there. So these are the two sides. One is having over uh, activity, and the other is having a lesser activity. That is depression. So these are the two sides of the same coin. That is that kind of mental aspect. Saying mental changes may happen in anyone. To identifying this and finding the doctor, that is a great thing. That is the need of the hour also. But when you talk about this doctor, that patient may say that, doctor, I am very much concerned about the future of my children. I don't know what will happen if anything happened to me or to anything like that. Now, or sometimes she may tell that, doctor, I don't know how to move forward. If I have some cancer or something like in my body, what will happen to me? So these kind of anxieties are there with the most of the ladies, and sometimes they may hide everything. They may tell because of the pressure, and it's, sometimes due to frequent deliveries, the uterus may having some kind of some relapse or something like that. But she may not tell to anyone that, doctor, I have in the fact towards the family member or somebody else, that I am having this much of problem. But these are the things you need to consider when a patient come with, and some people may develop hypothyroidism or hyperthyroidism at this period of time. That is also very important. And as we homeopaths, we need to think of the patient's totality, that we also say the physical as well as the mental constitution. And as you know, the ladies become more younger, it looks like more beautiful in their life. They may get, some ladies may be little, very, very slim in the, when they are younger. But at the time of menopause, they may become fatty and become more smarter and looks pretty than what they were. So this kind of changes can happen. That's why that's also happens at the time of menopause. So that is also to be considered. And sometimes the belly become very, very heavy, and they are having very big size bellies, and they don't know what happens. Doctor, is there anything in my fat in the abdomen? I don't know why this is getting growing and growing like this. But that is because of fat deposits and the change, because of the hormonal changes. Even though some ladies may say that, doctor, I am doing lot of diet control, but still I am getting fatty. I don't know why this is happening, why this is. But this is because the hormonal changes that happens at the time of menopause. And that also is a very important aspect that we have to consider in those conditions. So, as you all know, that the homeopath, what a homeopath need to do is just sit with a patient and the surrounding, the bystanders, and take the case. And taking the case is very important. Some they may say, the doctor, I don't know. I was usually sleep with the covered pillows and everything, but nowadays, there's some very hot, very heat. I am feeling very heat in my body. I'm having profuse sweating. I used to sit in with the AC, but still I am sweating, and I may have to take bath frequently. Morning also, I took some cold bath. In the evening also, I am taking bath. First, even at night, I may go to the bathroom and sit under the tap for getting cold. So these kind of hot flashes that we used to say, the hot flashes. This is also a very important thing that may happen in the life cycle of a woman at the time of menopause. So as we all know that most at the age of 45, what may happen in the family also in between, if they are having children, particularly girls, the child is a daughter, children are daughters, then naturally they may reach the marriage age, that is wedding age, may happen in. So she may be much worried about how I can find a better person for my children, like that. So all these things will force her into several stress, and that stress itself will lead into different problems in her. So, as we all know that if the patient is old and having so many problems, we may have to think of laxatives, nature. So hot remedies can be considered, and almost all melancholic remedies, particularly graphitis, sepia, silicea, these are chilly remedies, and they also come into the picture in a different way. So we will have to find the simillimum to the patient and administer it with the symptoms corresponding to them. That's what a homeopathic doctor need to do, and we will have to give some prescription, and of course the diet condition. Most people, the most important aspect is we need her to do some little bit of exercises, and particularly in that to in morning or evening, not in the night. But things are people used to say that, oh doctor, I have no time in the day or evening, but I'm ready to do it in night. But it is absolutely wrong to take exercise in the late night. When the body is tired, you need rest. You take rest at that time. That's what we will have to think do. And as far as diet also, people used to take late suppers. So avoid that late supper. Whatever be the thing you eat, you just cut it to the half size of what you ate in the late in the lunch. So that also is a very good, very important matter. Whether it be better to reduce carbohydrate, particularly whether it is rice or um, butter, maybe better to cut it to half size and take as much of vegetables, leaves, and all those things. And we know that in order to, if the body is fatty, you require a more calcium as well as protein diet. So that also a very important factor to look into. Most people having anemia. That's the reason why we used to say that you like to take a lot of fruits as well as vegetables along with your diet, and better ask the patient to avoid late night suppers. Nowadays, it's a habit that if people used to eat things after 10 p.m. And they may so they may go to sleep by 12, like that. But it is better to take at least 3 hours before sleep. That's a very good, very important factor. And better to do the basic physical exercise. No need of heavy. Some people may used to go to gym, but it is not advisable to go to gym. But it is better to do the normal physical exercise, and at least 15 minutes walk in the morning and evening. That's good. And this is how one can manage the problems rising during the menopause. And we can give the medicines accordingly. And if there is a lot of bleeding, then we will have to think of pathology prescription. Particularly, we have a lot of medicines for that. I'm not going to specific about those medicines. We can discuss all those things from others also. So this is what I would like to add to the session at the beginning. And over to Dr. Sheila, we can invite Dr. Bipu Prasad Pandesar.
So, Dr. Bibu Prasad sir, can you suggest anything for this
I am
menopause?
audible, madam.
Yes, of course.
So, as Dhanesh sir told, it is a normal physiological phenomena, a natural physiological, what I am called transitional period, because of loss of ovarian follicular functions, and it occurs between 45 to 55 age. And homeopathic has a great role because in allopathy they have no medicine at all. They have having tranquilizers. They are giving tranquilizers to give temporary relief, but we have having certain medicine as sir told. So the objectives of homeopathic management in the management of menopause, that is relieve vasomotor symptom. Vasomotor symptoms, as we know, they are hot flushes, night sweats. So during menopausal phase, what happens? There will be night sweats and hot flushes. Improve psychological well-being, our motto, that is anxiety, depression, irritability. Those who are adapt the swing, that means it is a miscommunication between hypothalamico, pituitary, ovarian axis, and the hormones estrogen they decreases. That's why this type of mood swing occurs. And we have to manage the sleep, because during menopause there is sleep disturbances. To manage the sleep and fatigue, we have having medicines. We have to select medicines on the basis of individualization, not a general medicine. So you have to address genitourinary symptoms, that is vaginal dryness, recurrent duties, because during menopause there is dryness of the vagina, which because of that there may be dyspareunia. So these conditions must be managed by proper homeopathic medicine. We have having good medicines are there. Then enhance over quality of life, because what happens during menopause, the lady may be come in depressed phase. So there must be proper counseling, that it is a normal physiology. So you do your duty and adapt it. You have to accept it. So when we are accepting the age, as Dhanesha told, during the cycle estrogen secretes is more. That's why what happens, the lady looks beautiful and everything is okay, but when there will be decrease in estrogen, so this thing does not occur. That's why we have to adapt the situation. So reduce the need of hormonal therapy, because it is a physiological phenomena. We should not administer any type of hormones like estrogen. If you administer estrogen, then other physiological function may be disturbed. That's why we should not administer any. We should not go to hormone therapy. We have to change our lifestyle. We have to adapt the situation. We have to adapt the normal physiology. Then it will be better for our purpose. Then in homeopathic approach, that should be individualization, as I told. So in individualization, the prescription must be based on physical symptoms, mental and emotional characters. As sir told, if the patient is hot, if there will be consolidation aggravates, if there will be headache which is aggravation and night sweat, you may prescribe natrium. So the different medicines are there. So on the basis of individualization, we must select the medicine. Then mental and emotional characteristics, that should be our approach. In lachesis, there is the mental symptoms are very prominent. In graphitis, the constitution, the lady will tell that I have having the history of delayed menstruation and habitual constipation, and licoria gushes day and night, and there is sensation of cobweb in the head. So such type of symptoms must be considered as for totality, and accordingly you have to prescribe the medicine. And in that stage, what happens, the lady becomes more sensitive. That's why the potency must be medium or higher, not lower potency. Then constitutional makeup must be considered, as I told, that if the constitution is fair, fatty, flabby, and is menopausal time, then graphitis need to be select. And accordingly the constitution is of thuja, then thuja must be administered. Then past medical and family history must be taken, because if there will be family history of mood swing in parents, that means mother, then accordingly we may consider the medicine. Then past medical miasmatic background must be considered. So miasmatic background, for example, if you will not get any physical symptoms like infiltrative diseases, proliferative diseases, or inflammatory diseases, or destructive disease, but we have to consider the latent miasms. For example, in behind Sora, the psoric patient is very quick to act. The action is quick, and easily fatigue both mentally and physically, weeping disposition, desire for hot warm food, so and very mixing nature, compromising nature. So on the basis of these things, we may give antipsychotic medicine, administer antipsychotic medicine to get relief. Second thing, in psychotic phase, same thing. The psychotic patient is suspicious, vindictive, jealous, and the psychotic patient, they take a pause before giving the answer. These are some latent psychotic symptoms that must be considered, and accordingly we may give anti-miasmatic medicine, that is antipsychotic medicine like thuja, medorinum, nitric acid, causticum, etc. And if there will be melancholic temperament, the lady becomes shy nature and does not give answer, introvert, then we have to think about natromur, because natromur patient is introvert patient, but she should be hot patient, and the mental symptom, she must be aggravated by consolation, then aversion to bread. So such type of symptom we must consider to give natromur. So if you give this type of medicine on the basis of individualization, yes, you may consider the modalities and concomitant symptoms. For example, in concomitant symptoms, in history, if you get that all the pains are relieved by menstrual flow, then you may consider like a zinc metallicum like this. And if the complaints they started, that means the irregularity it started since menarche, then pulsatilla also may be the medicine. So on the basis of the symptomatology, we need to consider the medicine. Second thing, holistic care must be adopted. We should not consider the menopausal symptom only. We have to consider the patient as a whole, because the trinity of life as homeopathic considered their body, mind and soul. So as a unity, we should consider the patient as a whole. On the basis of holistic concept, we have to select the medicine not in pathological basis, not in particular symptom basis, but in general symptoms. Then we will be success and the patient will get relief. Second thing, the emotional adaptation. Then we should give counseling to the patient that this is a natural phenomena. So these things will happen. There will be mood swing, there will be night sweat, there will be hot flashes, and so there will be irritation. So if the lady knows that after 45 the irregularity of the menses start because of hormonal control, that is a physiological process, and he understand it, then she will adapt the situation, and the mood swing will be less. Then she will be not depressed, and if she feels that my beautifulness will be removed, so my lady's quality will be gone, so this will create depression. So we have to convince the lady that these things happen to each and every lady in the world, not only you. So you accept it, and after accepting, you continue your daily routine work, and after some times, when the time passes, so automatically it will be adjusted. So this type of counseling we have to give the lady. As Dhanesh sir told, our lifestyle must be changed. So we have to think more about the prayer, yoga, exercise, and we have to talk with our colleagues and our friends. We should share our symptoms. Definitely those who have already gone through this period, they will convince you that these things happen to me and I pass it. There is no problem at all. You do your duty. So you have to do connection with your friends of equal age. When you do like this, then you have to change your lifestyle. You have to pray the God, you have to do yoga, you have to do exercise, then you have to discuss about the good things, and these things must be ignored, because this is a natural process. You do or not do, it will come. So if it is inevitable, so why should you think about these things? So mood swing, definitely after the age of 45 it will occur. After 50 the menses will stop. So everything will happen. If this thing happen, so we should not be bothered about that. That can be changed by adapting what I am the social service and other engagement which will remove this type of thinking. And then psychological stressors like family stress. For example, at the age of 45, 50, our son and daughter, they will get married. We should not involve in the matter of our son or daughter-in-law. If you involve what they are doing, why they are not doing, why my generation is not growing. So these are not our headache. Our headache we have already completed, they have already settled. So we should not enter in the work of our son or daughter-in-law, or some ladies, what they do, they told that they advise her daughter that you don't bother about anything of your peers, of your what I am telling, sasural. We don't think about them. You come whenever they will do anything, then you come to me. So this type of interference is very bad, and these are stressors. Second thing, what others are doing, what other family members are doing, how my neighbor is growing, the money is growing, he is growing in every, whatever we are getting, that is our luck, and we are getting this. We should be thankful to God that these things we are getting, and we are having a place to live, we are having food to eat, we are having a good family. So as we are telling, jo prapt ho paryapt, this type of thinking should be adopted. Whatever we have got, that is sufficient, and we should be satisfied. And if you maintain a satisfied life, then the mood swing will not disturb you people. So then second thing, hormonal changes. In hormonal changes, never adopt any type of hormonal therapy. It will disturb other, because this is a natural process. Natural process must not be disturbed. Then constitutional treatment must be done. A well-selected constitutional remedy aims to restore the body's adaptive mechanism and improve general health. A constitution is the soil in which disease grows. So if we will give constitutional medicine, even our constitutional medicine like lycopodium, like calcarea, like sulfur, like thuja, they will help to mutate our gene, and they will enrich our constitution. So when our constitution will be enriched, when our constitutional position will be good, then but naturally you can able to adapt any situation that may be adverse, that may be not comfortable to us, we can adapt it. So many people, so many ladies, even they are getting pain in the family, they are not exposing it. They try to adjust by themselves, they accept the situations. In the last stage, all you know, the Ramakrishna Paramahansa, he was suffering from cancer, and he adapted. So these are the things, definitely by nature it occurs. So we must not avoid any natural phenomena. We have to go through the nature. If we go with the nature, we will suffer less. Second thing, the selection must be individualization, and as I told, I am telling some symptoms of some medicines, like your lachesis, that is a good medicine for climatic age, menopausal time. So lachesis, but we have to go through the symptoms. The characteristic symptoms must be there: hot flushes, intolerance to tight clothing. Lachesis patient cannot wear tight clothing, even cannot do not need any type of necklace, any type of tight dresses. So always she prefers loose dresses. Second thing, everything aggravated after sleep. So sleep aggravation, that is a characteristic symptom of lachesis: hot flushes, sleep aggravation, tight clothing, and she is very talkative. We know a lachesis person is a talkative patient. Even one word leads a story. So if you are telling that that is a chair, that lady will tell that there are different type of chair is there. The chair is red, that may be red, that may be blue, that may be yellow. So if it will not break, then she will continue even hours. So if she is converting a word into story, then you have to think about lachesis and left-sided complaints. All the complaints of lachesis, it starts in the left and go towards right. So these are the characteristic symptoms. Apart from that, if the lady is complaining any type of pain that is traveling from left side to right side, the patient is hot patient, and if you will see the tongue, then there is trembling tongue, like snake tongue, snake. So if there is trembling tongue, if the patient is talkative, if the patient is hot, and she is in climatic age, then lachesis is a very good medicine, and it helps to cure the conditions and bring back the normal condition. Sepia is another medicine, as sir told, but in sepia we should understand the characteristic symptoms of sepia. Sepia is called he lady. Why it is called he lady? Because of the pelvis. So sepia pelvis like android pelvis, not gynecoid pelvis. If the pelvis is wide enough, then you have to think about, you can't give sepia. And the lady always crosses the leg while sitting, because she has a feeling that there is prolapse. So if this type of symptom will get, and again the sepia mentality indifferent to near and dearer. So the patient will not like son, her husband, so she does not like it. So if, and weeping disposition also, and aversion to opposite sex. So if this type of symptoms will get, then you can select sepia, and sepia will help to get relief from the mood swing. Then the pelvic weakness is one of the main symptom, and again hot flushes, exhaustion, and sepia patient, we know if he is suffering from asthma, that asthma is ameliorated by dancing. So certain symptoms which are very characteristic for sepia, then we may prescribe sepia during climacteric age, and main counseling, and that will help to adapt. Then next medicine, that is pulsatilla. So pulsatilla, we know that is a lady's remedy, and mild, yielding disposition, very simple, and sober lady, beautiful lady, blonde eyelashes, delicate eyelashes, and weeping disposition, and when the sepia lady relate any complaint, cannot relate her complaint without weeping, open air amelioration, mood change. So if this type of symptoms will get, then you may think about pulsatilla irrespective of climacteric age. Of course, pulsatilla is a very good medicine for the complaints of menarche. That means in the initial stage, in pulsatilla, in Allen's keynote, it has been clearly written that if the complaint arises since in the commencement of menarche, then without going into details, this medicine can cure any disease. That may be rheumatism, that may be body pain, that may be irregularity of menses. And pulsatilla is a very good menses for amenorrhea. So though it is a very good medicine for menarche, but it can be prescribed if the totality is very similar to menopausal syndromes. After pulsatilla, you may think about sulfur. Sulfur, you know that is the king of antisoric. It is a functional disturbances. There is no structural change. There is decrease of estrogen. So because of decrease of estrogen, there is disturbance in hypothalamus pituitary ovarian axis. So and FSH increasing. So in this stage, so if you will think about sulfur, that is a good medicine, but we have to think about the characteristic symptom of sulfur. For example, if happy dreams wakes up singing, so that is not related to anything, but if you are getting such type of dreams, then you may think about sulfur, because it is a characteristic symptom. Again, heat in the vortex, burning sensation. Burning sensation is the burning. It comes under three burning medicines of NAS: sulfur, sulfur, arsenic, and the third one, the burning phosphorus. So sulfur is very good medicine when there will be burning sensation, when if the patient is a react philosopher. Yes, so then if she is a react philosopher, if there will be burning sensation, if the lady is having dreams, that dreams, happy dreams, wakes up singing, Gana, singing, and after sleep, she comes up, she wake up, then the hot flashes will get early morning weakness. So in sulfur there is aggravation early morning, as it is a king of antisoric. So you may get all the soric symptoms, that means functional disturbances, and if you get functional disturbances, hot flushes, and that is peculiar hungry of sulfur, that hungry at 11 a.m. So if this type of symptom will get, then you may prescribe sulfur, and sulfur burning pain is ameliorated by cold application. So these are some symptoms if you get, then on the basis of totality we can prescribe sulfur in menopausal syndromes or menopausal mood swing. Then after sulfur, the next medicine, that is Sanguinaria canadensis. Sanguinaria canadensis, that is a very good medicine for menopausal problem, where you will get sudden flushes of face with burning heat, climacteric headache. So Sanguinaria, we know that is a medicine for hemicrania. So hemicrania, especially right side. So if there will be right sided headache during menopause, and there is hot flushes, there is burning heat, then Sanguinaria can be prescribed, as Laches is for left, like Sanguinaria is right, Spigelier for left. So if during climacteric age there is headache, and that is right sided headache, then Sanguinaria can be prescribed, and it will give relief to the mood swing. Then next, glonine. So glonine, that is a very good medicine for hot flushes in climacteric period. So glonine, that is violent congestion to head. So it is a medicine for congestive headache like your belladonna. So glonine, but hot climate aggravate the complaint. Throbbing headache with flushing is exact like belladonna. That is in belladonna there is throbbing carotid, and the headache ameliorated by covering the head. But glonine is medicine where there is violent congestion, and because of congestion there is hot flushes and throbbing headache, then aggravated by sun heat, aggravated by gaslight. So in those cases, even in climacteric period, we can prescribe your glonine. Next, calcarea carb. Calcarea carb, that is a deep acting antisoric remedy. So deep acting antisoric remedy, to the students we are teaching, that always try to remember SCL, sulfur, lycopodium, calcarea carb. So these remedies, they follow well one after another. That means after sulfur, calcarea carb, then lycopodium. So they follow well each other. So if you prescribe one medicine after another medicine, then you will get good result. So these things must be remembered, and accordingly you may treat. But the calcarea carb patient is obese patient. A obese patient, it has been clearly written, when there is fair fatty flabby, and the patient feels better when constipated. So when the patient feels constipated, calcarea carb is indicated, and there is sweating in neck region. So if there will be sweating in neck region, as we are getting in menopause, that is night sweat, weakness. So you will get here in calcarea carb also, and that is perspiration, anxiety, easy fatigue. The calcarea carb patient easily fatigued, like your latent sora. So if the patient is having the complaint of easily fatigueness, then there is sweating, and even the sweating smells sour. If there will be sour sweating, and if there will be what I am telling, the patient is chilly patient, of course, and there is anxiety, and the patient feels better when constipated, then calcarea carb, the medicine can be thought of. Then simicifuga. Simicifuga is otherwise called as Ectia racemosa. So Ectia racemosa or simicifuga, that is a very good medicine for menopausal complaint also. So Ectia racemosa, Ectia spicata, then colchicum, these are the medicine for small joints rheumatism. If the lady is having small joints pain, and the lady is in depression, if the lady is nervous, if the lady is muscular pain, and lady is in menopausal mood, then we must think about the simicifuga. So simicifuga is a very good medicine. If there will be history that during there is history of dysmenorrhea, more the flow, more the pain. If this type of history will get, and that pain in history you will get that the pain always it travels from one side to another side. That means it will travel, shifting pain is there, and the more the flow, more the pain. And there is a mental symptom as if a mouse is running behind the chair. So mental symptom always bear prime role in case of physical complaint. That may be menopause, that whatever it may be. If there is sensation that a mouse is running beneath the chair, then you may consider about ectia racemosa as the for the person. Then your ignatia. We know ignatia and natremur, they are complementary. Ignatia complementary is natremur. So when there is grief, when there is symptoms of contradiction, then you have to think ignatia, because ignatia is a medicine that is a great medicine for contradiction. So if that means dysphagia ameliorated by deglutition, that should not be, but it is occurring. So if this type of symptom or contradictory symptom you are getting, then you may think about ignatia. Then auxiliary measures, some auxiliary measures need to be taken during menopause. Apart from medicinal treatment, apart from counseling, apart from lifestyle advice, we have to go certain auxiliary measures. On the auxiliary measures, already sir told, Danesh sir, that balanced diet rich in calcium, protein and vitamin D is required. So the lady must take calcium, protein and vitamin D, because calcium has lost a lot during delivery, during pregnancy, during lactation. So obviously the lady may suffer from osteoporosis. So to prevent osteoporosis, we must give calcium supplement to the lady. And protein diet is essential for energy. So you know, the essential proteins are very much needed for energy production. So protein diet must be given. Then vitamin D nowadays, what is happening, those ladies who are maintaining sedentary life, those who are not getting exposure to sun, so they are usually suffer from vitamin D deficiency. And vitamin D deficiency is very essential for bone formation. Calcium, phosphate, vitamin D, so these are very essential. So vitamin D, especially vitamin D3, can be supplemented during the menopausal time to prevent our bones. Second thing, regular weight bearing exercise. Weight bearing exercise, that should be depend upon the capacity of the lady. So if this type of weight bearing exercise will be done, then the muscle tone will be sustained. So what happen in aged lady, the muscles, the tone is lost. So when the muscle tone will be lost, it will cause looseness of every outlet. So during coughing, urine may pass. So if muscle bearing, weight bearing exercise will be done, then it can be prevented. Then adequate sleep is required. So at least 6 to 7 hours is needed for a lady of menopausal age. So if she is suffering from mood swing and if there will be depression, then there may be sleeplessness. So she must take abundant sleep to get relief from his mental swing. So we should not prescribe any medicine. We have to avoid medicine, but we have having certain medicine to bring a proper sleep, like your medicine Passiflora. So Passiflora mother tincture, if it is needed, if the patient is suffering from insomnia during menopause, that Passiflora mother tincture can be prescribed to bring sound sleep. Tranquilizer medicine should be avoided. Then stress management. So because of the menopausal swing, the stress automatically comes. Those ladies who are involved in different household affairs of the family, they always purchase your stress. So don't interfere in the family matters. You concentrate yourself, you think about your health, and you do prayer whenever you are getting time. You do yoga, you do exercise. So if you will not think, so we have no, we see it should be not required to think about other matters. So that should be avoided. Stress. So that is main stress which we are purchasing. That is the interfering of the matter of our neighbor, the matter of our family. So that should be avoided, and negative thought must be removed to get relief from mood swing. Then smoking cessation and limited alcohol. Ladies should not be smoke. Nowadays, what we are observing that the ladies they are used to smoke. So smoking and alcoholism. So during the menopausal period, it is very bad. If you are suffering from any type of mood swing, if you are getting sourness, if you are coming into the depression and you smoke cigarette, you take alcohol, so the position will be degraded. For a time being you may get relief, but after that the condition will aggravate. So taking alcohol, smoking cigarette must be avoided to get rid from the mood swing. Then regular health screening. So during menopause the lady must be screen her health regularly in regular basis. If we screen her health regular basis, then what is happening, we can treat, we can manage accordingly. For example, we need to measure the blood pressure. If the blood pressure is increasing, accordingly we have to take the medicine, or we have to restrict the food which like salt. So management can be done properly. Second thing, that blood sugar. So some nowadays diabetes 2, type 2 diabetes is a common problem in our India. So it is a burning. India is a hub of diabetes. So in that case, we have to measure blood sugar regularly if we are suffering from diabetes, and you have to restrict sugar. You have to take anti-diabetic drug if it is required. So regular monitoring of blood pressure, diabetes, even the vital signs. The vital signs means pulse rate, blood pressure, respiratory rate, and temperature. So these things must be regularly monitored to manage the normal health in menopausal period. Then second thing, your lipid profile must be considered, and monitoring should be done. So lipid profile helps to know about cholesterol. So accordingly, triglyceride, if the triglyceride is more than 150, then accordingly you have to take the medicine. Then your breast and cervical screening must be done, because in this period there may be chances of tumor in the breast. So you have to take care of the breast. So this is the period when the malignancy starts. So breast cancer may start. So breast examination is required during menopausal period. Then cervical screening. So cervical screening must be done. So because nowadays cervical cancer is a burning problem. So this type of cancer occurs and starts during the menopausal, because the secretion of the vagina is completely stopped. So when the secretion of Bartholin gland stops, when the secretion of vagina stops, which is antibacterial in nature, so there will be dryness of the vagina, there is pain, there is irritation. So cervical screening must be done. The swab must be taken, so to eradicate the malignancy. Bone mineral density were indicated. So what happens there? The bone mineral position must be screened, because this is the time. After that, what happens there? The bone destruction starts, the osteoporosis starts. That's why I suggested to advise the patient to take calcium supplement, vitamin D, and this will help to prevent osteoporosis. And osteoporosis is a great problem, and it will make the lady immobile. Even I have seen that in late age the bones breaks automatically. So that is because of the lack of calcium and phosphate. So these things must be considered. Next thing, the clinical studies suggest that individual homeopathic treatment may improve menopausal symptoms and quality of life in some women. So individual, because 5 fingers are not equal. If 5 fingers are not equal, the problem of 5 ladies are not equal. So what happens there? The trigger factors that may from the family, that may from the neighbors, that may from the colleagues. So as the trigger factors are different, as the constitution is different, as the diathesis is different, as the temperament is different. So we have to consider the person as a whole. Though 5 ladies they are suffering from menopause, the 5 ladies may require different types of medicine, homeopathic medicine, to get relief from the mood swing, because of the concept of individualization. So we should not forget individualization. So this is our principle, and accordingly we have to select a similar medicine on the basis of totality of symptom. We have to consider the quality totality, not the quantity totality. Quality totality means the totality which can be perceived, which cannot be seen by naked eye. For example, a lady is always thinking about suicide. Aurum metallicum is the medicine that cannot be seen. That is extracted by keen observation, keen questionary. So quality totality must be considered. Individual treatment should be done, though for the every patient, not in general treatment like lachesis, graphitis, calcarea. This type of random medicine should not be prescribed, because that is a way of prejudiced treatment. So we should be unprejudiced. So we should consider every case as a new one. So considering every case as a new one, we have to prescribe medicine accordingly. Then it will be better to get rid from the menopausal problem. Then precautions. What are the precautions we should take during menopausal period? The precaution: homeopathy should not replace appropriate medical evaluation. So if the lady is taking some allopathic medicine for diabetes, for sugar problem, we should not stop it. We have to give our medicine. Yes, tapering method may be adapted. So slowly we can withdraw, but we can't stop the medicine immediately, because it will lead to withdrawal effect. So because of withdrawal effect, the condition may aggravate. So that's why we will prescribe our medicine, but in tapering in slowly manner, by which at last the complete medicine can be stopped, not immediately. Second thing, post-menopausal bleeding, breast lumps, unexpected weight loss, severe depression, symptoms suggested of osteoporosis or cardiovascular diseases require prompt conventional medicinal treatment. So during menopause, if these things we will observe, that means we will find breast lump, then we must refer the case to gynecologist. So it may be a case of breast cancer. If we find that there is unexplained weight loss, if the patient is having weight loss, then you have to refer the case to gynecologist. Otherwise, we may lose our patient. The patient condition may be deteriorated. So proper reference of the case is also required during menopause. Then women at high risk osteoporosis, if osteoporotic symptoms are found in women, so or cardiovascular disease is there, then genuine based preventive care alongside complementary treatment must be taken. For example, we have having medicine Critagus, that is a heart tonic. If there is a history of angina, if there is a history of heart problem of parents or family, then if the patient is very anxious, then Critagus like medicine can be given as a preventive measure. So it will strengthen our heart muscles and heart diseases can be prevented. Then in conclusion, I want to conclude my suggestion that homeopathy offers a patient-centered, individualized and holistic approach. Patient-centered, individualized and holistic approach. So that may be menopause, that may be menarche, that may be any type of dysmenorrhea, menorrhagia, polymenorrhea, whatever it may be. So these are all outcomes. So we should not consider the outcome, we should consider the patient as a whole, we should consider the patient, not the disease. So considering the patient, we have to treat patients. Our treatment must be patient-centered, individualized and holistic approach must be there to manage menopausal symptoms. It may help improve physical and emotional well-being when prescribed according to homeopathic principle. If we prescribe homeopathic medicine under our principle, that is similia similibus curantur, that means mono, mini, simi, then definitely our medicine will help the patient to get rid from the menopausal mood swing, and we can help a patient to continue regular lifestyle in a normal way. Because in some patient may do suicidal tendency develop because of depression. So proper treatment, individual treatment, holistic treatment with moral remedy, if you consider the patient, you may treat it properly and the patient can get cured. Second thing, lifestyle modification and appropriate conventional medicinal care remain essential components. Lifestyle measurements means proper balanced diet, exercise, yoga, prayer. So these things are very essential to because these are the things which occurs in normal person. This is a physiological phenomena. These are not pathological phenomena. So to get rid from the physiological phenomena, we should not bother about medicines. We should change our lifestyle. If we change our lifestyle, then automatically we will get rid from that mood swing. So patient-centered, individualized, holistic approach is best approach to treat the menopausal mood swing, because that is a hormonal disturbance, and that disturbance is obvious, that is physiological, so we should not bother about it, and homeopathy can manage better manner in in comparison to other conventional medicine. Then while lifestyle modification and appropriate conventional medical care remain essential, for example, a patient is taking blood pressure medicine, don't stop. If the patient is taking diabetic medicine, don't stop, because if you stop it, it will give bad effect or the withdrawal effect may occur. So considering all the things as a whole, considering the patient as a whole, we have to treat by our constitutional medicine, our simillimum, our anti-miasmatic medicine, to get relief from this type of menopausal mood swing, which is physiological, which is normal. So awareness in the uneducated area is very essential by our community medicine department. Thank you very much.
Thank you, sir. Even though our today's guest was absent, so Dr. Danish and Dr. Bibu Prasad Panda sir bridge the gap actually. Thank you so much, sir. Danish sir also give a elaborate section of this menopause, the diet and the homeopathic management, and over that Dr. Bibu Prasad sir also give an elaborate section of the symptoms, its precautions, what are the diet and regimen we have to say, what are the investigations we have to do, all these things very clearly he given a very good explanation. Thank you so much for this time with us, sir. And I think
we can,
only
we
two
can,
minutes more, sir. Yeah.
We can invite Manoj doctor for vote of thanks.
Yes. Dr. Manoj sir, please.
വളരെ നന്ദി. എന്തായാലും a nice presentation was done by Dr. Bibu Prasad Panda, even though it was quite accidentally happened. Nice presentation. Thank you for your endeavor to fulfill the gap. People like you are definitely a real treasure for IFPH as well as homeopathy. On behalf of IFPH, I express sincere thanks to Dr. Bibu Prasad Panda and all those participants in this session. Thank you.
Sir, you want to speak something or tomorrow's session or anything?
Yes, I shall announce it now. Please wait. Tomorrow we will have a session from Dr. Wrinkle Z. Adar, and she is an MD scholar from Rajkot Homeopathic Medical College, and we'll be talking about clinical management of contact dermatitis from diagnosis to individual homeopathic approach.
Okay, sir, thank you. So once again, thank you, Dr. Danish and Dr. Bibu Prasad sir for this bridge the gap actually. Once again, I am telling. So I think our time is over. So we are passing on to the Malayalam session. So I want to thank you all who have participated in this session. Thank you so much, sir. So good night. Bye.
Over to Mariamma doctor.
നന്ദി ദിനേശ് ഡോക്ടറെ.